First at 6, a KSHB 41 exclusive.
The burnout in medicine is exceedingly real.
Inside a local hospital during what some medical professionals say is the toughest moment of this pandemic.
I don't have faith that it's gonna end.
I just want everybody to understand the stress that the healthcare system is under right now.
And this explains it all. The daily average of new hospitalizations remains at extraordinarily high levels, well above the peak seen twice before in this pandemic.
The fact that we did see a greater reprieve earlier, we have people that have been doing this for 30 years, and it's still a lot.
You heard it there. The pandemic has put significant stress on our local healthcare system and frontline workers.
Now, we want to warn you, some of what you're about to see may be difficult to watch. KSHB 41 News reporter Dan Cohen was granted exclusive behind-the-scenes access to one ER and ICU.
This, it isn't a drill.
Ready? 1, 2,
And this team, they're not actors. This is the St. Luke's Emergency Department in Kansas City, as another COVID-19 patient is intubated, needing a ventilator to breathe. And here, you can see things in an hour that you hope to never see in a lifetime. But this is the life for those in the battle against an enemy they cannot see. At the time of our visit, the health system's numbers were the highest they've ever been.
217 patients who have active COVID. Another 70 patients are still in our hospital dealing with the after effects of their coronavirus illness. Of those 217, only 10 are vaccinated.
The first floor ER is a scene of nonstop movement of staff, new arrivals, new challenges to fight.
Every single one of the ERs in the St. Luke's health system for the last 1 to 2 weeks has been boarding patients. By boarding patients, I mean that a patient gets admitted to the hospital, there's not a bed available for the patient, and therefore they have to sit in their ER bed for extended periods of time.
And when they are admitted to the ICU,
they stay in that ICU for 27 days on average right now. So every time I admit a patient to the ICU with COVID-19, I lose an ICU bed for 27 days.
Those rooms upstairs, they're full. The nurses on the floor work long shift after long shift.
So we do 3 12s a week is our base. A lot of us are working more than that, and we say 7 to 7, but it's usually 6:30 to whenever we get out. If I get home by 8 p.m., it's usually a good night.
This current surge has depleted their ranks.
Staffing's been in crisis mode. Yeah.
Really?
Yeah.
Crisis mode?
Well, crisis mode because there's a nursing shortage in the country, and people being out.
Yeah.
The degree of illness they see is severe, and it does not discriminate by age.
We have a guy in his early 20s here. He was fortunately extubated, but he had no past medical history, and he lifted weights and stuff. I can barely get him to the chair. So, and he has a baby on the way. So that's a lot to take away from a young, healthy, young 20-year-old.
They continue to fight for those whose bodies cannot fight for themselves.
We'll take care of anybody in any room that we can, in any place that we can, especially if those patients need us.
These doctors, nurses, respiratory therapists, and all of their other frontline brothers and sisters in arms, their battle continues.
Has this been the worst phase of the pandemic for this hospital?
I would say personally, this has been the worst phase because this, I believe, has been the most preventable phase of all of our phases.
Preventable, they say, because the war cry has not changed.
Go get vaccinated, go get boosted.
The overwhelming data is so robust that it is safe and both effective in eliminating severe coronavirus. It will help mitigate the current onslaught that the entirety of our country, and in particular our community, is seeing right now.
It was a tense visit for our team here at the St. Luke's Emergency Department. That intubation you saw at the beginning of our report, that was a newly admitted patient who registered a code blue. That's the hospital term for a patient who goes into cardiac or respiratory arrest. Kevin and Dia, back to you.
Dan, nurses talked about recovery after critical care in the hospital. What did you learn about what patients have to confront when they get home?
Yeah, Dia, one of the nurses we spoke to said that some patients who are placed on a ventilator, some of them have to undergo a tracheostomy, and they have to learn how to eat through a feeding tube. And this nurse told us there's a lot of anxiety for patients who are starting a new life and aren't returning back to the life that they once knew, even after they survived that critical care phase here in the hospital during their COVID-19 stay.
Dan Cohen, powerful live report at St. Luke's tonight. Thank you for that. You heard it from the doctors in that story. Vaccination can curb the onslaught in our community. As of today, roughly 2 out of every 5 people in Missouri and Kansas have not received the vaccine. If you're ready to get vaccinated but you aren't sure where to start, go to KSHB.com. You'll find this story. We have a list of vaccine sites and resources available for you right now across the metro.